My name is Gwyneth Lyman, and this is a systematic review of the mental health considerations of having an animal companion on low-income populations. This review aims to study literature on the impact of companion animals on the mental health of low-income populations using articles from PubMed and CINAHL. In the U.S., there are over 500,000 people experiencing homelessness, and they often have an increased stress level and higher rates of mental health issues when compared to people living in homes. This is thought to be due to the stressors of finding shelter, food, and higher rates of drug and alcohol abuse. Interactions between animals and human populations has been shown to reduce anxiety, depression, loneliness, and increase the general well-being of humans. And in the United States, 87% of pet owners regard their companion animal as a part of their family. Overall, it seems that many in the homeless population and low-income populations would benefit from animal companions, but there are a number of barriers that might prevent homeless and low-income populations from accessing proper care for their pets. These include access to services, access to education about important health indicators in animals, and a lack of communication due to cultural or language barriers between the client and the vet or other provider. Despite many of these shocking barriers, there are close to 19 million people living below the poverty line in the United States who have pets. The primary sources were taken from PubMed and CINAHL. Search terms included low income, human-animal bond, and mental health. Originally, 28 articles were identified. 8 of them were removed due to duplication, and 20 were screened for relevance. After the initial screening, 9 articles remained to assessment, and 1 was excluded after a full text assessment. This produced a final of 8 articles for this review. 2 of these 8 studies were cross-sectional studies looking into the relationship between low-income humans and their animal companions. 2 of them were case studies analyzing this relationship. 2 more were cross-sectional studies looking over the attachment of owners to their animal companions. 1 of the articles examined the knowledge of social workers supporting companion animals in their work with individuals through a cross-sectional study, and the last one provided background on the relevant history of the animal-human bond. Overall, 5 of the articles found that having a pet supported each owner's mental health, especially in low-income populations. All 4 of the studies analyzing the relationship of an impoverished owner and their pet found that having one was associated with a better mental state, improved routines, greater human connection, and overall improved happiness. 1 article even found a greater association of food security for pet owners, shown in Figure 1 on the right. All of the articles studying the human bond found that pet owners had a strong attachment that did affect the mental health of their owners. In the United States, homeless and low-income populations face a great deal of problems in everyday life. This often leads to an increase in stress and shows an association with a greater rate in the development of mental health issues. Having a pet was shown to have a positive effect on the mental state of their owners, which may be due to the social benefits of having a living being that one may regard as a family or friend. This systematic review found that mounting evidence that pets are an important factor in the mental health of many populations, especially in the case of low-income peoples. However, this may only be due to the smaller size of sample populations, as training in the animal-human bond for mental health professionals is uncommon or at best touched upon. More studies might employ a longitudinal framework to better understand how the mental state of each person might change over time and how this might be affected by the absence or presence of an animal companion or pet. The findings of this study may impact public understanding of the support animal companions provide for homeless and low-income populations. Further research should be employed, though, to better understand this bond, and more support should be provided to those in a hard financial situation for the care of their animal companions. This has also shown that clinical professionals should seek training in the importance of pets in the everyday lives of their clients. Overall, animal companions play an essential role in the mental health of many low-income populations, and we as a nation must stand up to better provide for both humans and animals for the benefits of humanity as a whole. Thank you.